Hello everyone, my name is Bill Potts. I'm a physiotherapist at Perfect Motion Physio, and this session, which is linked to another video that I've done, is really looking at doing a small exercise session to help those people who may be suffering with back pain, hip pain, knee pain, and these are some common exercises that we prescribe a lot of people with those conditions. What I would say, of course, is that it's really important that you get assessed and make sure that these exercises are appropriate if you happen to be suffering from back pain, hip pain or knee pain, to make sure that you're not doing anything that might irritate things. But otherwise, these are some great exercises to help both reduce your risk of getting those problems and help manage the problems. So we'll get into it. All you're going to need is, if you haven't got an exercise band, it's really, in this case, I'm just going to be using it for stretching. So just a belt will do. And then I'm going to be using a ball as well, but you can just use a cushion. So again, just for doing some general exercise, strengthening work on the legs. So this is all going to be, all these exercises are floor-based. There are alternatives that can be done in standing as well. But we're going to do everything on the floor. We can kind of tackle everything there, both in terms of the stretches and the strengthening work. So if we, first of all, we're going to look at doing some work for our buttock muscles, our hamstrings, and our inner thigh muscles, so our adductors. So you're going to have a lie on your back, and then we want you to try and think about getting into a good position in terms of your posture, so that we can load the correct muscles and hopefully not injure ourselves. So keep our chin tucked in, so you can draw your chin down towards the floor. Think about making the back of your neck nice and long, and then drawing the shoulder blades down again into the floor, so down and back towards each other. And you almost want to try and feel that your shoulder blade is sitting flush on the floor, or as close as possible to that position. So keeping shoulder blades and head in the same place, I'm going to get you then to tilt your pelvis backwards and forwards. So you're using your lower tummy muscles to tuck your bottom under, flattening off your lower back into the floor, but without going so far as you start to lift your bottom up, and then tilting the pelvis the other way, where you're going to start to arch that lower back. And again, here you're using muscles in the small of the back, which you may be aware of, sometimes not so aware of. And again, you're just going to rock backwards and forwards between those 2 points. And then we want you to find a point roughly in the middle. So all we're doing at the moment is trying to get you set up so your spine is in a neutral position, pelvis is in a neutral position. And then we're going to go from here. So taking a breath in, we're going to start off just doing a general bridging exercise. So as you breathe out, press down through your heels, and you're pressing straight down into the floor. You're going to start to peel your spine up off the floor. Think about keeping your pelvis in a neutral position. Breath in at the top, breathing out, slowly coming back down. And you should feel that as you lift up, you're working in the buttock muscles. You've got a little bit of tone through your pelvic floor. Your pelvic floor extends from that back passage all the way up and round to the front. And you're making sure you're breathing throughout the exercise. So you're always doing an out breath as you lift, and then again as you lower down. Try and make sure the direction of push through your heels is straight down into the floor, and that will help ensure that you're using your bottom and your hamstrings, but not your thighs, so you don't feel you're pushing yourself away from your feet. So I'm just going to do a couple more of these, and then we're just going to change things slightly, where we're going to start to introduce some work in our inner thigh muscles. One more. And down. So if you grab your cushion or a ball, if you happen to have one of these, pop it between your knees. Again, make sure your pelvis is in neutral your shoulders are drawn down and back, your chin is still tucked in. And as you breathe it out, you're going to squeeze that ball. So you're going to squeeze, think of about sort of 50-60% effort. So we're going to work reasonably hard, and you're going to keep that pressure on. And again, all you're going to do is press down through your heels, keep the pressure even on the ball throughout, and we're going to start to lift up into our bridge again and slowly down. So just a variation of our bridge, but where we're starting to now also recruit our inner thigh muscles, our adductors a bit more. Keeping that 50-60% pressure on the ball the whole time. And you may also feel that you work a little bit more into your hamstring, where you're doing this squeeze on the ball. So we're now also starting to work a bit more through your hamstring. So your adductor muscle is one of the adductor muscles, adductor magnus, is very, very large. And we consider it really to be almost like a fourth hamstring. So really important functionally. Hopefully starting to get a little bit of fatigue building in now, starting to feel both inner thigh muscle, buttock muscle and hamstring all working reasonably hard. Last one. And relaxing down. So you can pop that ball out, pop the feet together, so soles of the feet together, try and keep pelvis in neutral. And you're going to drop the knees out and away from each other. So you're trying to now get a bit of a stretch through your inner thigh muscles. Holding that there. Again, try and think about good posture through your pelvis, shoulders and head. Keep breathing. Again, make sure this isn't painful. So no stretches should be painful. They may feel quite strong and intense, but they shouldn't be painful. Big breath in. As you breathe out, create a little bit of tone through your lower tummy and pelvic floor. Bring the legs back together. And then we're going to take the legs slightly further away from us. So they're going to go back to, feet are going to go back to hip distance apart. Again, we're going to be up on our heels, so the front of the foot is off the floor. And we're going to do similar, so same sort of bridging exercise, but the direction of push this time is going to be down into the floor and in towards our bottom. So we're going to really try and target the hamstrings as much as possible, keeping again pelvis in that neutral position, shoulders back, chin tucked in. So again, pressing down, pulling in towards your bottom, lifting up. So you almost want to imagine you're dragging your top half down towards your feet as you pull up. And this will feel quite strong in your hamstrings, especially if you're a little bit weaker in that area. Sometimes also if you have to use that area a lot. So it can feel quite intense. We're going to have a good stretch after this. Again, nothing in your lower back. Last two. It's quite a strong exercise. And then relaxing down. So now we're going to grab your belt or band if you have one. I'm going to pop it under one foot. So the other one can relax, just rest it down, foot on the floor, knee bent. And then with the belt around the foot, the knee straight, holding on with both hands. Get that leg as high as you can where you start to feel a pull in the back of the thigh. And it might extend down just past the knee. And from here, we're just going to get you to pull your toes towards your head, and that will increase that pull down the back of the leg, and then point away. Pull towards the head, point away. So as you point away, that stretch will reduce. As you pull up towards you, it will increase. So then we're going to get you to rotate your leg at the hip, so the foot rolls out, the leg turns out, and then again repeat. Same foot movement. Then rotate the leg inwards, and again repeat that foot movement. And back to the middle, soften that knee, swap legs. Legs straight, pull the toes towards or foot towards the head, and then point away. Trying to keep that knee straight the whole time. Still try and think about posture, so pelvic position, shoulders and chin or head. I'm going to rotate that leg outwards and again repeat, trying to keep that knee straight. So as I said earlier, this shouldn't be painful. It can feel quite intense, but it shouldn't be painful. Then rotate the leg inwards and repeat. Last time. And back to the middle. Soften that knee. And then we're going to get you onto your side. So if you have a lie on your side and you want to try and get your soles of your feet in line with your bottom, your back and the back of your head. So at home you might start off by doing this up against the wall or against the base of the sofa just to get your alignment correct. And then again you want to think about tilting your pelvis forward and back, finding a point in the middle. And then we want you to think about lengthening through your top waist. And this is to ensure that your lower waist isn't sort of dropped down onto the floor. You want to feel that you're kind of lengthening through your top waist, getting one hip directly above the other. So then from here, maintaining that position, we're going to get you just to turn your leg outwards. So this is called a clam exercise. So we're just going to do 10 to 12 of these, nice and slow. So we're not rushing and we're making sure that we're just moving from the hip. So there's no rolling backwards and forwards, and then your top waist is lengthened away. Then we're going to keep the knees together and rotate that top leg inwards. Again, making sure that as we do this, the movement's coming from your hip, the foot should remain relaxed, and you're not rolling forward at the pelvis. I'm going to bring that top leg to hip height. Then we're going to bring the leg forwards, and as you bring the leg forwards again, you've got to just double check that you haven't tucked your bottom under and rounded off your lower back. You're still in that neutral position in the pelvis, and then you're going to bring that leg back behind you, making sure you're not rolling backwards or arching and extending your lower back too much. Forwards and back, forwards and back. Keep going. So again, roughly 10 to 12 of these movements. And you'll start to feel a little bit of fatigue in that buttock area. And then we're going to lengthen that leg away from us. Make sure our top waist is still lengthened. foot's still relaxed, and then we're going to lift up to that ceiling and down. So the leg stays, ankle, knee and hip and top shoulder should all stay in line. Make sure the leg doesn't drift forwards. And as that leg lifts up, ensuring the lower waist isn't dropping down into the floor. So lifting from that buttock should feel that you're really working in that bottom area. Couple more. And then resting down. While we're in side lying, again you can use a belt if you can't reach your ankle. We're just going to do a quad stretch. So really, a lot of people with knee pain will quite commonly have really tight quads. So we try and get them to do lots of quadriceps stretches. So in side lying is quite a nice place often to do this. Don't have to worry about balance. So again, try and make sure as best as possible you want to try and keep your leg back so your knee doesn't sort of drift forward too far, but keep your pelvis in neutral so you don't feel your lower back really arching and extending, because that can end up being painful. Again, resting down there, and then onto your back, and we're going to stretch that top buttock off. So foot's going to go across the opposite thigh. Keep again pelvis relatively in neutral. You can push the knee away, and that might be sufficient stretch for you. Or if you feel you need more of a stretch, you can hold the other leg, just pull that opposite thigh in towards you, and that again will increase your stretch in the buttock. A good long hold. And all the stretches, all the stretch components within this session, they can all be repeated through the day, and they can be done really frequently. You can't do too many stretches. You can force a stretch, but you can't do too many. So just ensure it's not painful. And if you do it really frequently, that shouldn't be a problem at all, and can be more beneficial. So resting down, and then we're going to move onto our side and push up to sitting position, and we'll go down onto the other side. And we're going to repeat the same series. So again, soles of feet, lower bottom back and back of head, pelvis in neutral and top waist lengthened away, keeping their feet together and rotating that top leg outwards. Good, so again 10 to 12 of these, then we're going to change, keep the knees together, nice steady controlled movement, make sure that foot is remaining relaxed, that top foot is remaining relaxed, all the movement is coming from your buttock area and your hip, no movement in the pelvis in terms of rolling forward or backwards. And make sure your top waist remains lengthened away, so you really feel your hip, your top hip is directly above your bottom hip. And bringing that leg up to hip height. Again, trying to maintain that neutral position in the spine, bringing that leg forward and back. So it's a really good hip series, this, for anyone suffering with hip, knee, back pain, especially where there is a component of weakness in that area, which is fairly common. I certainly wouldn't look to do these every day. You might look at doing them sort of 3 times in the week. Alongside other exercises, so other exercises that might be a bit more targeted towards specific problems or deficiencies that have been picked up on an assessment. Then we're going to lengthen that leg away, make sure that top waist is lengthened, pelvis is still in neutral, lifting and lowering. Again, should be getting a little bit of fatigue creeping into that buttock area. Last 2. And resting down. Again, we're going to go into a quad stretch, so try and keep pelvis in neutral. Good stretch down the front of that thigh. Try and ensure that knee isn't sort of lifting up. And then resting down, moving onto your back. Pop that foot across the opposite thigh. You can just push that knee away, which might, as I say, be enough of a stretch for you. And you're trying to feel it in that buttock area. Or if you need more of a stretch, just pull that other thigh up in towards you using your hands. Nice long hold. And resting down. Super. You can come back up to sitting. So that's a little quick session that you can do. Hopefully you feel good after doing it, if you've done it, and it's a bit of a help to you. Cheers.